opposed to those questions going to SHA, what is the ministry doing to ensure that when patients go to hospitals, seek for emergency treatment in hospitals, they are quickly attended to without requirement for them to pay? And how are you ensuring that anybody who is in an emergency wing of a hospital, public hospital right now, and cannot be attended to because the hospital is insisting that they have not been paid the SHA claims, how are you ensuring they are given support and they are attended to so that they don't have to suffer the consequences of those unnecessary conversations on emergency units when patients need to be treated? Is there any support in that communication and supporting the patient to get access to the health services?
Senator Chiranke.
Thank you, Mr. Speaker. I'm disappointed because most of the senators who were saying SHA is not working, like Senator Omogeni, are not here, including Senator Sifuna, but they are quick to yap in funerals that it's not working. Mine, Waziri Duale, is a very simple question. One, you want to ensure USC succeeds. What can you tell Kenyans that today SHA is working, and in terms of improvement of personnel that work within the value chain or the chain of universal care? Waziri, you and me know that there was a presidential directive, and I know the biggest obstacle has been COG on the issue of confirmation of universal health coverage staff that have been on contract, but I'm happy through your guidance as the CS of Health, the SRC has harmonized their pay slips. What is the status in transiting these UHC staff to permanent and pensionable so that we make SHA works? And Waziri, can you use this forum to tell the naysayers and doomsayers, including Senator of Muranga, that SHA is working? Mr. Speaker, I find it painful that many people out there are quick to say SHA is not working, yet they cannot come and ask the gracious CS. And I want to thank CS Waziri Duale, because he's the only CS that has always appeared religiously before this House. Unlike other CSs, I don't want to mention names, Mr. Speaker, because I will be accused of playing politics. But I know how to play it somewhere outside there, Mr. Speaker, not in funerals, but in birthday parties. I thank you, Mr. Speaker.
Senator Essie Okanyuri.
Thank you, Mr. Speaker. Whatever I wanted to ask was on the issue of UHC staff, which Senator Chiranke has already highlighted.
Senator Boni Khalwale.
Thank you, Mr. Speaker.
Yes.
I have listened in this House to the Minister and also in the media. When he speaks to SHA, he speaks to two cardinal issues: the success of registration and the challenges in the reimbursements. But in health delivery, the real issue is service. Up to now, St. Mary's Hospital is closed. Colleagues here, they want to play to the gallery to say, you want me to say it's working.
Senator Boni.
Yes.
Senator Boni.
Can you contain him?
Address the chair. Senator Fernandi, allow Senator Boni to make his point. Allow the Honorable Senator to make his point.
Thank you, Mr. Speaker. And therefore, when hospitals served by some of my colleagues and owned by some of them are owed 43 billion shillings by SHA, and NHIF is still claiming 33 billion shillings, How do you expect a clear-minded scientist like myself to say it is working? Anyway, Mr. Speaker, I want, with your indulgence, to allow me to ask the Minister, you have a chance to clarify today. What interest does the chairman of SHA have in the so-called metro group of companies, in the so-called Metropolitan Hospital and / stroke Labdan Hospital?
Senator Newton.
Thank you, Mr. Speaker. And while I want to commend the ministry for unearthing the fraud that had been perpetrated, costing SHA about 10.6 billion Kenya shillings. Mr. Speaker, the working or otherwise of SHA, like the majority whip has said, will be out there, Mr. Speaker. It is the confession of people who actually benefit or fail to benefit from a SHA that are supposed to tell the story, and not basically what the minister says here. And so, Mr. Speaker, it's important that through you we ask Senator Cherargei, to at least for once, act as a senator and not like that sycophant who only wants to talk about things that are working. Mr. Speaker.
Order, honorable senators. Are we not? Order, honorable senators. Senator Fernandi, Senator Fernandi. Senator Fernandi, order. Now, Senator for Muranga, Senator John Newton. I will not allow absurdity. Once you take to the floor, ask your question to the honorable senator. Proceed.
Thank you. I'm guided, Mr. Speaker. I only mentioned his name because he mentioned my name.
Just proceed to ask your question.
Okay, Mr. Speaker, there is an organization in this country, and this goes to the CS, Mr. Speaker. May I be heard in silence, Mr. Speaker?
Senator Newton, your statements are drawing these unnecessary
I'm asking my question as guided by you, Honorable Speaker. That's what I'm doing.
Proceed.
Can I be heard in silence, Mr. Speaker?
Proceed.
So my question to the CS, Mr. Speaker, is there is an organization in this country, Mr. Speaker, kindly protect me from Senator Cherargei.
Senator Fernandi, what is your point of order?
Mr. Speaker, standing order 101 and 105. Is it in order for the distinguished senator, Awamunyora Deharan, to accuse me of being a sycophant when I'm doing my legislative and oversight work? Can he either substantiate or withdraw? We are not in a public library somewhere in Canon. He can go and do his politics here, but not here, Mr. Speaker. I'm a man who has protected my name, Mr. Speaker, and reputation. I cannot be allowed by first-term senators to come and insult me.
Senator Newton.
Thank you, Mr. Speaker. You would think that Senator Cherargei was born a senator and calling others a first-time senator. Yes, I am a first-time senator, Mr. Speaker, and proud to be so. Because Senator Cherargei was also once a one-time senator.
Senator Newton.
My question.
That is not the point.
My question, Mr. Speaker.
Senator Newton, can you?
I'm asking my question. I'm asking my
question.
Order,
honorable senators.
I'm asking my question, Mr. Speaker.
Senator Newton, you
yes,
will
Mr.
take my
Speaker.
instructions. Yes. So be quiet as the chair gives directions. A point of order has just been raised by the Senator Fernandi, that you've gone ahead to call him a sycophant. His point of order is, would you substantiate that statement? If not, then you proceed to withdraw and apologize.
And ask your question. Thank you, Mr. Speaker.
That's point of order that has been raised. you cannot interject.
Mr. Speaker. Mr. Speaker, even as I follow your advice and guidance, and even orders, Mr. Speaker, Senator Cherargei has also referred to me as our Munyoro adherent. Mr. Speaker, probably, to be very fair, do we have such an outfit here in this Senate? And so, Mr. Speaker, I think let it be eye for eye. An eye for an eye, Mr. Speaker. He has referred to me.
Honorable Nyoto.
Yes, Mr. Speaker.
Honorable Nyoto, we cannot go down that route where absurdity breeds absurdity. I expected you or any other senator to raise on a point of order. The Senator Fernandi having called you that you're a, what was it again, Wamnyoro? Absolutely. The mere fact that no point of order was raised on that particular assertion. The chair cannot then intervene. But your assertion to the fact that the Senator Fernandi is a sycophant has attracted a point of order. Yours did not. In fact, I did not hear you in any way trying to raise a point of order on that assertion by Senator Fernandi. Nevertheless, the two senators, Senator Fernandi and Senator Newt. Senator Fernandi, you will proceed to withdraw that assertion. Thereafter, the Senator for Muranga will proceed to withdraw the assertion calling you a sycophant. And thereafter, you will proceed to ask the minister your question. Senator Fernandi, proceed to withdraw that particular assertion.
Mr. Speaker, the word...
Withdraw that assertion.
Mr. Speaker, as I withdraw and apologize, the word adherent means you support an idea or party. So it is good that the Senator has gone on record that this does not support him. So thank you, Mr. Speaker. I withdraw and apologize. Let the people of Muranga watch.
Senator Newton, proceed to withdraw that assertion.
Thank you, Mr. Speaker, and I'll follow the cue from the experienced senator from Nandi and say that a sycophant is only somebody who says things to please somebody else somewhere. With that, I withdraw and apologize, and Mr. Speaker now proceed to ask my question to the Honorable CS. Mr. Speaker, I was just bringing to the attention of the CS that there is an organization in this country called RUFA, meaning Rural and Urban Private Hospitals Association. And Mr. Speaker, hospitals under that particular association are not offering services to those covered under SHA. And Mr. Speaker, then my question to the Honorable CS is, exactly what plans are there to see to it? Because these hospitals serve very many Kenyans, Mr. Speaker, and without them recognizing SHA, then many Kenyans have a problem. That was my question, Mr. Speaker. Thank you. And thank you for your Solomonic wisdom and your impartiality. Thank you, Mr. Speaker.
Senator Osotsi.
Thank you, Mr. Speaker. Mr. Speaker, I want to ask my good friend CS a question on the status of NHIF reimbursements, which have been outstanding. If there is any breakdown that he can give this House. Because as we talk about SHA, we should also be alive that there has been long outstanding debts owed to these hospitals by the defunct NHIF.
Honorable Chair, Honorable Speaker, let me start with the first question that Honorable Beatrice Ogola. For record purpose, from the Kenya Medical Practitioners and Dentists Council, Honorable Speaker, that registers all our health facilities. The total number of health facilities registered in our country are 14,876, out of which public facilities are 6,005. 2, on the same, and the leadership and the Council of Governors is coming back to us. And COG is working with SHA to ensure that they update their bank accounts, particularly for the primary health care. And 2, still Ogola, SHA has a database with a very active number. Now the ones who are registered under SHA, both public, private, and faith-based, are 10,451 facilities, with each one having a provider portal rights. And payment for these facilities is dependent on the claim review process. Every claim on our dashboard in our system, even when it is rejected, it will give you the reasons why it's rejected. If you have not submitted required documentation, it tells you submit the following documents within 14 days. And different claims are in different stages. Some have just been submitted, some are under review, some have been approved for payment. So it's like a whole ecosystem, and that's why we call our digital system, we call it the digital super highway. When I come to the question raised by the leader of majority, Senator Aaron Cheriot, I agree with you, we will comply. We will comply with the law, and we will, Honorable Speaker, through you, we will give this House any information that is required within the shortest time possible, and I'm sure the members and the chair and the vice chair of the Health Committee know that whenever I am called, I appear. Just for example, to give you, under the PHC, the primary health care, which is exchequer funded, a very unique thing under this leadership. The problem, people who are opposing SHA are not the patients, are not the health facilities. People who have a problem with the government of President Ruto. And we have no problem with that. Because today as we speak, Honorable Speaker, over 27 million Kenyans have registered SHA. Mombasa leading, Nyeri number 2, Kirinyaga, Bomet. That's how I can give the list of all the counties. And under PHC, so far, the primary health care, we have given counties 5.6 billion since last October. And we are ready to provide county by county, faith-based facilities who attend to Kenya for this free primary health care. We have given them 745 million. We can give the list one by one. Under SHIF, county governments have so far, depending on how they do their claim, there are some county governments like Mombasa, like Nyeri, like Nakuru. And let me say it, Nakuru PGH is one of the best model that is implementing the social health insurance fund. Since October, Nakuru PGH and Coast General Hospital have received close to 1 billion shilling because they do manage their claims properly. The faith-based organizations have got about 12 billion. MOH, these are the referrals, Kenyatta University, MTRH, Madare, and all these. They have received 6.5 billion. The private facilities are the largest who have received under SHIF, 29.3 billion. This report is ready. We can provide it to the House anytime we are required. The animal or the elephant in the room is rejected, and I want senators to listen to me, Senator Cheriot being. If you see somebody asking you, there are a lot of rejections, he doesn't want to come and face SHA. In SHA, we have relationship managers at the county level, at our headquarters. Our system gives you reason. We have men and women, doctors who do clinical review, who will tell you why your claim is rejected. But because they know those are fraudulent, those are frauds, and we are coming for them, Senator, tell them we are coming for them. And why are claims rejected? I want to give you 5 reasons why claims are rejected. And once it is rejected, for the information of this House, we are not paying. Claims are rejected because there's no claim form. The law you passed here, the 4 laws, at the bottom of those laws, you have designed a claim form. So a claim form is a legal document. If a facility has not provided a claim form when they are asking for reimbursement, that becomes automatic rejection. If the facility has not given us itemized invoice, that is a rejection. If there are no discharge summaries, God forbid, let me pick on even Senator Cheriot or Senator Khalwale. You go to Nairobi Hospital, you stay there for 2 days, there's no discharge form. And it's deliberate because they want to claim 30 days when that patient has stayed for only 4 or 5 days. So if you don't give us a discharge summary on when the patient has left, that is a rejected claim. If there are no supporting theater, if a patient, a Kenyan citizen, who is a member of SHA, paid a member of SHA, goes to a theater for any type of procedure, and then you make the claim to the Social Health Authority for reimbursement, and you have not attached theater notes, doctors who are in this House will know that. I am not a doctor, but I read, and I learn from people I work with. If there are no theater notes, that's a rejected claim, and we will not pay. If there are no birth notification, if a delivery has taken place in any of our health facilities in our country, the mandatory document is a birth notification. If you want us to pay for your delivery, whether or normal or cesarean, and a birth notification is missing, we will not pay you. We cannot confirm whether a child has been born, whether a delivery has taken place. It's rejected, Honorable Senator, for Kericho. Upcoding. There are people, and this is a medical fraud. There are people, a patient goes for a small boil that takes about 1 hour. The claim they make is that they have done a bigger procedure by even cutting his hand. That is called upcoding, and the system will pick you, we will not pay you. If you convert outpatients into inpatients, that is the biggest fraud. There are Kenyans who go, they are treated, they go home, then the facility turns them into inpatients because they want to claim the bed. They want 5 days. But now, going forward, they cannot do it because now we have introduced a biometric. A Kenyan must go through the biometric when he goes to hospital, and he must go through biometric when he's being discharged. But before the biometrics, they were turning out patients, and we have got evidence of patients who have gone even to the DCI, who are saying, I went for a day. Why is this facility claiming 14 days? Honorable Senate Majority Leader, we will not pay. And please tell these people who tell about rejected, let them go to SHA, they will get all the explanations. As of today, there are people who tell you SHA does not pay. As of today, faith-based, and let me pick, and I want Honorable Khalwale to listen to me. St. Mary has been used for many months for political expediency. It became the talk in funerals and everywhere. I went and sat with the Bishop of St. Mary. I sat with the Bishop of St. Mary, with the whole of my team, including the bank manager. And we have shown our Lordship, the Bishop, that Shah has paid him 90 million shilling. We have given him the TT, the transfer. The balance that at time had was 14 million. We have paid the 14 million. It is you now to go and ask the bishop why he's not opening the facility. And the bishop was with me in a press conference. And I said it, and I said it. Let us not use, St. Mary for politics. And I'm saying it, and I'm sure the people of Kakamega are watching me. Look for something else. St. Mary is a closed chapter. You cannot use St. Mary based. We have the numbers. Before the end of the day, Senator Boni Khalwale, I have sent to you on your WhatsApp more than 5 times. You did not respond to me. I gave it to Prime Cabinet Secretary. When nobody could hear, I flew to Kakamega. And I sat with the bishop. And we did reconciliation. We proved to him that we have paid him 90 million. If today I pay Nairobi Hospital, for example, and the management decides not to run the hospital and close it, that is not a function of the minister. For health. But for my brother Boni Khalwala, number 3, our system is real time. Number 4, St. Mary owes us 8.5 million, and St. Mary owes us 8.5 million, and all these upcoding. There are people, and this is a medical fraud. There are people, a patient goes for a small boil that takes about 1 hour. The claim they make is that they have done a bigger procedure by even cutting his hand. That is called upcoding, and the system will pick you, we will not pay you. If you convert outpatients into inpatients, that is the biggest fraud. There are Kenyans who go, they are treated, they go home, then the facility turns them into inpatients because they want to claim the bed. They want 5 days. But now, going forward, they cannot do it because now we have introduced a biometric. A Kenyan must go through the biometric when he goes to hospital, and he must go through biometric when he's being discharged. But before the biometrics, they were turning out patients, and we have got evidence of patients who have gone even to the DCI, who are saying, I went for a day. Why is this facility claiming 14 days? Honorable Senate Majority Leader, we will not pay. And please tell these people who tell about rejected, let them go to SHA, they will get all the explanations. As of today, there are people who tell you SHA does not pay. As of today, faith-based, and let me pick, and I want Honorable Khalwale to listen to me. St. Mary has been used for many months for political expediency. It became the talk in funerals and everywhere. I went and sat with the Bishop of St. Mary. I sat with the Bishop of St. Mary, with the whole of my team, including the bank manager. And we have shown our Lordship, the Bishop, that Shah has paid him 90 million shilling. We have given him the TT, the transfer. The balance that at time had was 14 million. We have paid the 14 million. It is you now to go and ask the bishop why he's not opening the facility. And the bishop was with me in a press conference. And I said it, and I said it. Let us not use, you know, St. Mary for politics. And I'm saying it, and I'm sure the people of Kakamega are watching me. Look for something else. St. Mary is a closed chapter. You cannot use St. Mary based. We have the numbers. Before the end of the day, Senator Boni Khalwale, I have sent to you on your WhatsApp more than 5 times. You did not respond to me. I gave it to Prime Cabinet Secretary. When nobody could hear, I flew to Kakamega. And I sat with the bishop. And we did reconciliation. We proved to him that we have paid him 90 million. If today I pay Nairobi Hospital, for example, and the management decides not to run the hospital and close it, that is not a function of the Minister for Health. But for my brother Boni Khalwala, number 3, our system is real time. Number 4, St. Mary owes us 8.5 million, and St. Mary owes us 8.5 million, and all these were lodged in the month of October. By the 14th of November, our next payment cycle, if these 8.5 are verified, we will pay. But so far we are paid 114. And please help me. I'm sure this weekend you'll be in Kakamega. I want you to have a different story. To say that St. Mary, Shah has explained, St. Mary, the problem is the management, is the leader.